Okay, good morning, everybody. Well, sorry about the delay. We'll go ahead and get started. Do we have any announcements? Anything? Okay. All right, no announcements this morning. We are going to try to finish up on time. I'm sure you saw that we have a working lunch, so we'll take at noon, whenever we break, we'll take a few minutes to get a lunch and get settled back in, and we'll keep working all the way through so that we can get out at a good time. So the first thing we have on the agenda is a discussion of the recommendations that we had identified as that we wanted to have further discussions or consideration. So to go through those, we'll look to Leanne to kind of walk us through what we had flagged last time. Okay.
All right, Leanne Thone, KLRD. Good morning to the task force. So at your spot, you should have an agenda and a draft copy of the working group report to the Senior Care Task Force. This has all of the changes that were discussed in the last meetings in August in red. I sent these to your email. You also have a hard copy, and this should also be on the ks.gov website under the Senior Care Task Force for those of you that are online. I also sent it to people that told me that they were going to be virtual, so that should be at the top of your inbox for your convenience. So I'm going to talk mainly about the working group recommendation changes and not so much about the little tiny changes that to language and things like that were not significant. So I'm going to start on Roman numeral 7, the working group recommendations. We had one change of tier, and that is recommendation 7.2. We changed the title of that to promote the PACE program and altered the language a little bit, promote the expansion of rather than expand. This moved from tier 1 to tier 1 from tier 3. The next change is going to be on page 5, regular number 5, not Roman numeral. Cross-cutting recommendation 1.1, the statewide aging conference. The task force agreed to add a bullet point under ease of implementation about broadband connectivity issues may prevent stakeholders in rural and frontier areas from attending. It was also agreed to add the legislature to the action lead and remove them from key collaborators. I believe that was due to appropriations. Next page, recommendation 1.2. It was agreed to take the MCOs from key collaborators and move them to action leads for this recommendation. On page 7, recommendation 1.3, education training credits. This recommendation was flagged for follow-up discussion as a note. There was some language changes here to provide standardized training. And then the action lead legislature was moved from key collaborators to action lead. Key collaborators added and included Kansas Advocates for Better Care, Kansas Adult Care Executives, Kansas Healthcare Association, and Kansas Center for Assisted Living. Recommendation 1.4, the legislature was added as an action lead. Recommendation 1.5, Rural Healthcare Coalition. Broadband connectivity issues were also added to this recommendation under ease of implementation, and the legislature was added as an action lead for legislation and appropriation. Page 11, recommendation 2.1, geriatric psychiatric prescribers. There was a small language change to better ensure in the recommendation language. The legislature was added for appropriations. I think we were a little unsure about that one, so we put a question mark, but that was what we understood. Ease of implementation score was also changed for this one to a 3. Key collaborators added were BSN, I'm blanking on that acronym at this moment. State Board of Nursing, okay. Board of Pharmacy, and pharmacists in general. And then next page, recommendation 2.2, psychotropic medication education. We added KABC, CASE, KHCA, and KCAL to the key collaborators on that one as well. Now we're going to skip to page 15, recommendation 3.1, workforce clearinghouse. This recommendation was also flagged for follow-up discussion. The bullet point about the alert system at KDADS for when infractions occur was removed because I think it was not going to be a feasible thing to implement. The action leads, KBI, was added, as well as the legislature was moved over from key collaborators. Recommendation 3.2, background checks. The task force removed while prohibiting direct resident care until background check results are available from this recommendation. And the legislature was moved from a key collaborator to an action lead. Recommendation 3.3, abuse, neglect, and exploitation training. Added to this recommendation were first responders such as law enforcement and fire personnel in terms of who will receive this A&E education, and a language change to provide standardized training. DCF was moved from a key collaborator to an action lead here, and KDHE was also added as an action lead. Key collaborators added include KABC, CASE, KHCA, and KCAL, the AAAs, and MCOs. Recommendation 3.4, legislature was added as an action lead for an appropriation. Key collaborators added were KABC, CASE, KHCA, and KCAL. Recommendation 3.5, legislature was added as an action lead for legislation. Key collaborators added were KABC, Disability Rights Center of Kansas, CASE, KHCA, and KCAL. Recommendation 3.6, this one had some additions. Pass legislation enacting the supported decision-making agreements and to accomplish the following. And this language was added from the subnote for 2021 HB 2122, 2001-22, to reflect that a similar bill would be desired. Legislature was added as an action lead for legislation, and key collaborators added Disability Rights Center of Kansas. We're going to skip over 3.7, 3.8. Legislature was moved from a key collaborator to an action lead. Other key collaborators added were AAAs and the VA hospitals. Recommendation 3.9, we added 2 key collaborators, KHA and the AAAs. On recommendation 4.1, moving to page 25, the legislature was removed as a key collaborator on this recommendation. Recommendation 4.2, KHCA and KCAL, CASE and KABC were added as key collaborators. Recommendation 4.3, the legislature was added as an action lead for a statute change, so legislation would be needed. Recommendation 4.4, adult care home survey website. There were some language changes here. KDADS will indicate any facility in state receivership or under the operation of the Secretary for Aging and Disability Services. And KDADS will indicate ownership or recent changes in ownership. Meant to take the place of the recommendation to include poor performing homes and homes experiencing financial hardship. The legislature was also added as an action lead here for appropriations. And now we're going to skip all the way over to page 41. Or actually, no, we're not. Never mind. Sorry. We're going to look at 5.1. That's on page 30. Some language changes here. Reactivate was the word chosen, and we took out representatives of older adults. Recommendation 5.2, some small language changes there to indicate all facilities, including those not participating in Title 18 and Title 19 programs for the Dementia and Alzheimer's Disease Coordinator. And then recommendation 6.1 on page 33, there was quite a bit of change to this one. Took out the bullet points, and the task force agreed to sort of reword this. The legislature should explore the modification of all Medicaid waivers as applicable to those age 60 and older to provide more aging services such as home-delivered meals, case management, access to technology, and training. In addition, ensure those on the IDD waiver, age 65 and older, are also offered services available to those on the frail elderly waiver. The legislature was added as an action lead here for a statute change and a state plan amendment. Key collaborators added were KABC, Leading Age Kansas, CASE, KHCA, KCAL, Interhab, and the CDDOs. 6.2, the task force agreed to add a note about considering marketing home and community-based services at the statewide aging conference referenced in recommendation 1.1. Key collaborators, hospital discharge staff, nurses and social workers, nursing home discharge planners, MCOs, KABC, Leading Age Kansas, CASE, KHCA, and KCAL were added as key collaborators there. 6.3, transition services. Case management services was changed to transition services in the recommendation language. The legislature was added as an action lead. Key collaborators added included the long-term care ombudsman, MCOs, Leading Age Kansas, KABC, CASE, KHCA, and KCAL. Recommendation 6.5, this is on page 37. There were some language changes here to explore utilizing, and in the rationale, KDHE would need to explore the state plan amendment. KDHE was added as an action lead, and key collaborators added were KACE, KABC, KHCA, and KCAL. All right, now we're going to page 41. Recommendation 7.2, promote PACE program growth. That was edited, that title, from expand the PACE program. This, again, was also a recommendation that was moved in tier from 3 to 1. And the language here was also changed a bit. The state of Kansas should promote increasing access to PACE in rural parts of the state to serve as a hub to administer social models of adult day services that focus on person-centered care for the needs of older adults and increase the eligibility criteria for the program area, and provide financial incentives to rural hospital outpatient services to be PACE providers in smaller communities. All right, recommendation 7.3, adult daycare locations. Language was added here in the recommendation. In addition, expand the reach of the current PACE program and other providers to transport services and workers to those being served in-home, utilizing general transportation systems already in the area to get those skilled people and their equipment out to homes when necessary to minimize costs and expand accessibility. The action lead here, legislature was added for an appropriation and removed from key collaborators. 7.4, community partners pilot, a language change here to change to encourage. And KDADS was added as an action lead. Senior centers and local community coalitions were added as key collaborators. Recommendation 7.5, adult daycare volunteers. This recommendation was flagged for follow-up in conjunction with 9.9, identify future workforce. And there was a small language change to encourage at the beginning of that recommendation. So we're moving to 8.1, incentivize providers. That's on page 47. And some language was added to the rationale. The 2022 legislature approved an additional 3.00 million state general funds in fiscal year 2022 to increase the funding for Senior Care Act services. This recommendation would use those funds to implement these rates and rate pass-through. Recommendation 8.2, one-time only service caps. The line about Medicaid lifetime cap on assisted services was removed. Legislature was moved from key collaborator to an action lead here. And a key performance indicator was added, number of people served through one-time only service. Recommendation 8.3, the elder count book. The elder count book should be published biannually in print and electronic formats. That was added to the recommendation. And in the rationale, the task force also suggested exploring the annual kids count data center as a model. Key collaborators include Leading Age Kansas, CASE, KHCA, and KCAL. Recommendation 8.4, a couple of bullet points were added here to collaborate with initiatives expanding broadband services around the state and make it available in congregate settings, and to seek assisted technology of Kansas in collaboration for this technology investment. Key collaborators, the Office of Broadband Development was added here. Recommendation, we're going to skip over 8.5. There were no changes there. To 8.6, Senior Care Act data systems, KABC, KCAL, and the MCOs were added as key collaborators here. Okay, and now we're going to go to page 54. The next change is on recommendation 9.2, the Connect to Care jobs platform. The task force added a note. 7 states currently use this platform, including Colorado. And the action lead legislature was added for an appropriation and removed from key collaborators. 9.3, workforce incentives and benefits. We had a note that on rationale, there would be national and state level examples added. Those have not been added yet, but I thought I would note that. Action lead, KDHE, and legislature was added. The legislature for an appropriation, and both of those were removed from key collaborator. 9.4, workforce tax credit. Language was changed a bit to explore the creation of. 9.5, caregiver tax credit, same change to language, explore the creation of, and a note was added to the rationale. Oklahoma and New Jersey have model bills that could be adapted here. Recommendation 9.6, cross-sector partnerships. KDADS was moved from a key collaborator to an action lead. Recommendation 9.8, the change is on page 59, and the legislature is added as a lead on that for an appropriation. KCAL and KABC were also added as key collaborators there. Recommendation 9.9, identify future workforce. Again, this one was flagged for follow-up in conjunction with 7.5. I believe there was discussion about these being building blocks for 7.5 being a building block for 9.9, or there being some shifting with 7.5 being a volunteer recommendation and 9.9 geared more toward the direct care workforce. The recommendation language was changed a little bit to indicate both direct care workers and volunteers for aging services to identify future workforce. And recommendation 9.10, eliminate barriers to workforce entry. A note was added to indicate that if 9.2 was implemented, the direct care work group with advancing states would be referenced there. And then the last change is reflected in Appendix C. This is page C1, and this just shows, again, that 7.2 was moved from a Tier 3 recommendation to a Tier 1. I also realized today that we need to edit that title because now it is Promote PACE Program Growth instead of Expand PACE Program. And then recommendation 1.5 also appears there because it was accidentally left out in the previous version of the report. And those are all of the changes that we indicated from the previous meeting. So just to say again, the ones that were flagged for follow-up explicitly in the previous meetings were recommendation 1.3 on education training credits, recommendation 3.1 on workforce clearinghouse, recommendation 7.5, and that is in conjunction with recommendation 9.9. Yes.
Okay, so before we get into that further discussion, does anybody have questions on any of these changes that Leanne went through? Any questions or concerns? We'll have an opportunity to revisit that too. So
I'll also thank KHI for helping us make sure that we had all of these changes from the last meeting
okay,
indicated.
yeah, we really appreciate KHI. Okay, so let's go back to 1.3. Education training credits. And I don't recall what we needed to discuss further. I'll open up some discussion on that. Does anybody else remember where we were on that? This is what I was afraid of with going on to an extra day, that we wouldn't remember where we were at. So the recommendation is to provide standardized training for aging services. Lacey.
I am dusting off cobwebs, but was it maybe that we switched it from require to provide? Does that sound? Haley.
Haley, yeah. Sorry. It's been quite a morning. Haley.
Yeah, I think that was accurate. And I think the only other thing that I recall is I believe I requested from Jesse some follow-up on what was currently already in the requirements for education, which has been provided. And this recommendation already meets all of those requirements.
Okay, so you're okay with it from,
Yes, it was just a request in case anyone was questioning if by changing the language to provide standardized rather than require, if we were leaving anything out, and everything that's included in this is already standard, requires rules of participation.
okay, okay. Any other discussion on this one? Okay, so let's go to 3.1. That's page 15. And that's regarding the workforce clearinghouse. Any further discussion on this one? I'll give you a chance to look at it. So I think that under the rationale, that last sentence, interoperability has historically been an issue, and this would centralize a central location for consumers to access. I don't know why we had, do you remember why, Leanne?
Sure. Leanne Thone, KLRD. My notes just indicated the main issue, I think, was the alert system at KDADS. I also have a note about discussion in connection with survey issues. But I think the main issue was that last bullet that we did end up striking.
Okay, yeah, removing the alert system of KDADS.
Correct.
Okay. All right, any other discussion on that one then? Okay, we'll go to 7.5. Page 44. That's adult daycare volunteers. We just added the word encourage. Leanne?
Sure. My notes from this, we're looking at this in conjunction with 9.9, thinking about, do these recommendations cross-cut with one another? Because they both are talking about volunteers. And there were some thoughts about reworking them or linking them together, but there wasn't a clear decision on what the task force wanted to do with that.
I remember that discussion now. I'll give you a moment to take a look at that. See if we want to do anything else with it. Annette.
So it looks to me like 7.5 really is primarily focused on the training piece of it. It's encouraging to work with the different groups to work with the Alzheimer's Association and AARP to access training. So it seems like that could just be put as a bullet under 9.9, since it's basically training.
That would make sense. 9.9 is developing models for programs. So that would make sense to move that over. Does anybody have a problem with doing that? Okay. Are there any other issues with merging those? Anything else that we need to? Is the tier the same? Yeah, okay.
It's Annette again, Annette Graham, and I think that
Annette,
it
yeah.
would probably
Is
need
your mic
to-
on, Annette? I can't hear you
Is
very
it on?
Yeah, maybe closer to it.
Okay, there?
Yeah, we can hear you
Okay,
better.
so I think under key collaborators, we would need to change that. And I don't know if you would want to change anything about the rationale to add the partnerships.
Does she have her hand up? Hina, can we call on you to get?
Good morning. How are you? Um, I have like a little cheat sheet on the side, and so there were 3 that you wanted to integrate, so I wanted to make sure the committee was aware of that. It is 9.8 and 7.5 as well, with 9.9.
Okay, the 5-year career path plan.
So there was discussion to merge those 3 together, and so the committee was going to consider whether it makes sense to do all 3.
Haley.
Thank you, Madam Chair. I personally feel, and this is just my opinion, that 9.8 is more of the pathway. It makes sense to me to merge 7.5 and 9.9 to have the volunteer base, have the workforce, and then once we have them, then here's the pathway to work. So my personal recommendation and liking would be to merge 7.5 and 9.9 and leave 9.8 on its own.
Okay, that's kind of where my brain was going as well. Anybody else have discussion on that? Is there any objection to doing that then? Merging 7.5 with 9.9 and leaving 9.8 where it is? Good with that? Okay.
Representative Concanon?
Yes, Jan.
Jan Kimbrell, KSHL. My concern on 7.5, when we're talking about adult daycare volunteers, some folks don't have a career path 5-year, they just want to be they live in the community and they are the daycare volunteer. And it seems like we're leaving out those people who want to be trained a little bit further to be of help in daycare, but they don't want to go beyond a 5-year path. And it's the promotion part of bringing in older adults who may not be in small towns, not associated with the senior volunteer programs of AARP or those others, are kind of just left out there in, without any guidance or support. And if the state said, here's this opportunity, especially in small towns, to help out at daycare settings, also to provide the training for those a particular age group of folks that are taking care of a spouse or other loved one. I just want it said that not everybody that's going to quote volunteer has a career path in mind. They just want to help the people in their community. And it just seems like we kind of leave that little section out, but I don't know that there's any words you can say to fix it, so, but I just wanted mentioned that.
Okay, Haley, will you respond to that?
Yeah, I think, correct me if I'm wrong, would it be changing the recommendation title to identify future workforce and volunteer supports? if we did merge them together, I do see what she's saying, that it seems like it's leaving that component out.
So that would reflect what's been added to the first sentence, where it says both direct care workers and volunteers.
Yes.
So if we change on 9.9, change the title to identify future workforce of direct care workers and volunteers. Is that okay? Any objection? Okay, good point, thank you. Okay, that's all we had for further discussion. Do you want to go back through any of these changes and take more time with it? Or are you comfortable with the changes that, when Leanne went through those? Okay. We're all quiet.
Representative,
Rachel,
yes, good morning, everyone. I'm sorry
Good
I
morning.
couldn't join you in person. In looking through these, I would like to add the Kansas Bar Association as a key collaborator on 3.3. It just seems like if we can educate the lawyers who oftentimes see abuse and neglect and exploitation and undue influence and those issues in their office, that they should be a key collaborator on that.
okay. Adding KBA as an action lead or key collaborator.
Yes, that is correct, Madam Chair.
Okay. Any objection to adding that? Okay. Thank you for that. Any other additions or corrections? Changes?
Yes, Madam Chair, Annette Graham,
Annette.
K4D. I did have 4.
Oh, good. Okay.
Yes, so I will start with the first one, and that is on 6.3 on page 36. It's that first bullet on page 36. So it talks about assisting caregivers and older adults who wish to remain in their homes and choose not to enter an adult daycare. I think the wording is a little clunky to me because I think the transition often is for people that are in a nursing home and they want to transition out. So that language doesn't really speak to that. So just some wording change there.
What is the wording change that you recommend?
Who wish to live in their own homes and.
Where are you wanting to insert that?
So assist caregivers and older adults who want to return to their homes from an adult care home or long-term care environment.
Or- I'm not finding where you're at.
It's on
You're on 36?
page 36, the first bullet there.
The first,
at the
the
top
top
of the
bullet.
page.
Okay. Okay, gotcha. Say that again then. What would you,
So to assist caregivers and older adults who wish to return to their homes
do we
and
want,
transition from an adult care home or long-term care environment.
do we want to leave remain in there? Remain or return?
Yes, that would be fine.
That makes sense? Okay. So after, on the second,
Madam Chair. First,
yeah, Leanne.
hi, Lee Chaffee, representing Kansas Adult Care Homes. Would it just for simplicity's sake, would it make sense to say to assist caregivers and older adults who wish to live in their own homes and not enter, and not live in adult care homes or long-term care environments.
That would encompass all of that. That would simplify it. We good with that?
Was that your intent, Annette? It's just really saying they're choosing to live in their own home rather than right?
You're good with that, Annette? Okay. We'll just change that to older adults who wish to live in their own homes. So we're striking remain in there. Older adults who wish to live. I guess we need to add the words live in their own. So, okay, any objection to that one? Okay, Annette, what do you have next?
8.1 on page 47. So it is under the rationale, so it talks about using the additional $3 million funds. So I don't know that you have to indicate it's going to use those specific funds, just using Senior Care Act funds, because those funds have already been added to the budgets for the 11 area agencies on aging to provide the Senior Care Act services in their planning and service areas. So I don't know that we need to specifically say that it's out of that $3 million additional funds.
So you would propose that it reads the 2022 legislature, oh, no. You wouldn't want that sentence in there at all?
I think it's just the second sentence, so where it says this recommendation would use those funds. Maybe it
Okay.
could just say this recommended would use existing Senior Care Act funds.
Okay. This recommendation would use, so we would strike those funds and add existing Senior Care Act. I guess we would just strike those.
Yes.
Existing Senior Care Act. And then funds is already there to implement. Okay. Any questions or comments on that one? Any objection? Okay. What's next?
And then the final one is recommendation 8.2, 48. So here, under the rationale, we're talking about Senior Care Act, and we're talking about one-time only funding under Senior Care Act, because the request is service caps under that. But then in the last paragraph under rationale, it's referencing, is it on now? Sorry. Okay. So, sorry for that. So under the rationale, first we're talking about Senior Care Act caps and making revisions to those to increase that. But then in the rationale, in the last paragraph, we're talking about Medicaid and the action taken regarding a lifetime limit on assistive devices, but that's specific to Medicaid, not to Senior Care Act. So I'm not sure that needs to be here. I just question why that's referenced here when what we're talking about Senior Care Act and not the Medicaid program. I mean, there might be a reason to do that, but it seems confusing to me.
Does anyone recall the rationale for this rationale? Hina?
I think it was just to make sure we captured all of the discussion that was done during this recommendation. And so if the committee chooses to strike the second paragraph, I think that makes sense to do so. It was really because during the discussion, they were talking about both Senior Care Act funds, which this is under, and so Medicaid blurs it, but Medicaid lifetime caps came up because it was something that was done during the time frame as well. So it was just capturing the conversation.
Okay, good. So is there any objection to striking that second paragraph? I do think it's a little disjointed. I appreciate having the conversation, understanding what the conversation was, but yeah, it makes sense to take that out. Okay, I thought you said you had 4.
Well, originally I did, and then I reread it, and I no longer had a comment. So
Okay,
I'll
okay.
make it easy.
Thank
Only
you.
3. Thank you, Madam
Okay.
Chair.
All right, thank you. Anybody else have? Haley?
Thank you, Madam Chair. Just one quick little reference on 2.1, down under the key collaborators, that BSN, I believe should be KSBN.
What page are you on?
Oh, I'm sorry, page 11. Page 11, 2.1, under the key collaborators. BSN was added under there. I think it should be KSBN, Kansas State Board of Nursing. It is Kansas State Board of Nursing, KSBN, rather than BSN. Yeah. Yeah.
So, yeah, I think we agree that,
That's probably why I was confused about the acronym. It's like, I don't know that.
yeah. Okay, so that BSN should be KSBN. I was wondering on that one, the ease of implementation, we changed to a 3. Do we know what that was before? What the discussion was?
Sorry, Madam Chair, this is Hina
Yeah,
Shaw.
Yeah,
Which,
Hina.
which recommendation number is this?
2.1.
That response.
It was a 6 before. And remind us that the lower the number, the higher the
The
importance.
harder,
The-
for ease of implementation, the lower the number, the harder it is to implement. The higher the number, the easier it is to implement.
Okay. So we in our discussion, we thought it should have been more difficult than originally assessed. Okay, why don't you explain to us why, Leanne?
Sure. Leanne, KLRD. In my notes I have, there was discussion about billing codes, and that it might be more difficult due to having to change those codes, having workforce shortages, having the right collaborators, and making sure that they're all on board. So all of those things together, I think, had enough concern that it was agreed to change that.
Okay, thanks. Any other questions, concerns, discussion items? Okay, if not, we are going to move on then to discussion of the tiers for working group discussion, and that is in the front. The tiers start on Roman numeral 6. Okay, Hina, would you be willing to direct some discussion through the tiers?
Sure, Madam Chair, and I'm trying to figure out which ones to move, or how would you like me to proceed?
Why don't we just kind of have it, did we have some discussion on which ones to move already? I mean, other than the ones that we mentioned going through the report? I mean, I think there's just one that I see in red here.
So recommendation 7.2, expand the PACE program, was one of them. Recommendation 1.5, Rural Health Coalition, was left off of the list by accident, so that was added on. Other than that, there were no others that were flagged to be moved. Again, consulting my cheat sheet really quick.
Well, you know, it's been so long since we last met that I've slept a night or two, and I'm just wondering if we don't need a little bit of time to do maybe an overview. Would that make sense? What would you guys like to see? An overview? Okay. Hina, do you want to direct that, or do you want me to just run through them?
Either way works. If I would refer to the appendix, though, Appendix C might be the easiest place to refer to these. And that way you can see an overview of which recommendations fall under which topic areas. And those of you that are on electronically, you can go back and forth by clicking on the hyperlink.
Okay, so the difference is the one that is in the front is listed by tier, and the one in the appendix is listed by topic.
Exactly. And you can navigate to both of those tables by clicking on the links.
Well, we're looking at hard copies, so.
Well, at hard copies, I will navigate you back and forth if needed, but at least Appendix C will give you an overview by each tier, which recommendations have been designated for each topic area.
Okay,
And so
that
you
sounds
can
good.
see, yeah, you can see the trend of kind of 1 to 2 recommendations per topic area in tier 1, and then several in tier 2. That's kind of your more robust tier, hoping that some downstream effects would happen. So those went to tier 2. And then tier 3, you have a few that, you know, a few things need to be put into place, or it might just take a longer time to get there, or a lower priority at that point. If it's helpful to the group, the quality of care and protective services working group really prioritized by reviewing their potential to ensure older adults have positive control over their own lives. So ensuring safety, autonomy, quality of care in all the settings, as well as focusing on what can be done now, even as initial steps. And so that's why you see where they put certain recommendations in tier 1 and then others in 2 and 3. The Access to Services Working Group prioritized by reviewing their potential to empower older adults who prefer to remain in their homes and communities. And so that's how you see them reflecting their priorities also in the tiers. And then the workforce subgroup prioritized them by reviewing their potential to address retention of the current workforce first, and then recruitment of the direct care workers and course instructors and volunteers. And then lastly, training for the current and future workforce. Most of the cross-cutting Recommendations were either put in tier 1 or 2. Tier 1 was mainly done as something that really needs to happen now, whereas tier 2 may take some time. Would it be helpful to go tier by tier and ask if any should be moved to a lower tier?
Yes, I think that would be helpful.
Okay, so in tier 1, going through the first row with antipsychotic medications, preventing A&E, and surveys and fines, so really that work group A related topics, are there any from those that should be moved to a lower tier, or does everyone agree to keep those at tier 1? And the last one for work group A is on Alzheimer's, dementia, and mental health as well. So you have a total of 5 recommendations from work group A that are in tier 1.
Any discussion? Okay, we're good.
Good. Okay, and I apologize, I misspoke. The second row was work group B. The Alzheimer's, dementia, and mental health, rebalancing HCBS, daycare resources, and senior care act. So you have 1, 2, 3, 4, 5. You have 6 recommendations from work group B that are in tier 1. Are there any to move to a lower tier?
Doesn't look like we have any discussion.
Okay. And then the last one for workforce, there's only 1 recommendation for tier 1. They stayed true to what I asked. Any objections with this one?
I don't see any.
Okay. And then with the cross-cutting, there are 3 recommendations. 1 for the statewide aging conference, 2nd for person-centered practices, and 3rd for the Rural Health Coalition. Any objections to keeping those as tier 1 priorities?
Doesn't look like it.
Okay, so based on the definitions for tier 1, these would be recommendations that are either started and implemented right away, or if they take some time getting the groundwork laid kind of in the next year or 2. Then we go to tier 2, which is figure C2. Again, that first row is work group A. And so if you notice, there are several more recommendations here. We have about 10 in tier 2 from work group A. Are there any in preventing abuse, neglect, and exploitation that you would want to move to tier 3 that are now in tier 2?
Anyone see anything? Looks like we're good.
Okay. Any from surveys and fines?
We're good.
Okay. So then from work group B, there are none in that first topic area, but there's at least 4, 5, 6, 7, 8. And there are other 3 topic areas, starting with rebalancing HCBS. Would you like to move any of those to tier 3 or tier 1?
I don't see any discussion.
Okay. Adult daycare resources for reimbursement rates. Would you like to keep that here or move?
Looks like we're good.
Okay, and then the Senior Care Act, 8.4, 5, and 6. Any that you want to keep here or move lower? I remember data systems was one they went back and forth on a few times.
Yes, Lee.
Yeah, thank you, Madam Chair. I'm sorry. I would like to go back to recommendation 6.4, affordable housing. Just as I'm learning the lack of options for housing for really everyone, but specifically seniors, there's a lot of lack of options for affordable housing. I just wonder if the group might consider moving that to a tier one. If that's not addressed in the next 1 to 2 years, some of the other things that are listed in tier one might not be possible because they wouldn't have somewhere to go to live outside of the institutional or congregate living setting. I just open it up for discussion. Sorry to go back to that, but I just wonder if there's no place for them, no options for them as a place to live in a home, it could be difficult to help transition them out of that setting.
Any discussion on that one? Does anybody support the idea of moving that? Yes, Sarah.
Sarah Schlitter. I would agree. I think affordable housing, I think that impacts everything in terms of people, having their say and being able to live and reside in the place that they feel the most comfortable. So if others are in agreement, I would be in agreement with that. I think that is a good point.
Oh, Camille is online.
Hello, can you hear me?
Not very well. Can you turn it up just a little?
Well, and maybe I can get closer to the
Oh,
mic too.
nope,
Is
you
that
sound
helpful?
great. You sound
Okay.
great. Good
Thank
morning.
you so much. Thank you. I absolutely agree with this, and it is, we would be putting the cart before the horse. We can't. It's a barrier to transitions. We do need other key collaborators listed probably if we move that up as well.
So let's pull up 6.4.
It is on page 38, if that's helpful. Or 39.
It's 36 on ours.
36.
Yeah,
Apologize.
on our hard copy. So key collaborators, Camille, do you have a suggestion, something in mind that you thought needed to be added?
Well, I think definitely the housing authorities would have to be there. There's probably, honestly, Department of Commerce may have some suggestion about who should be at the table for that as well, for housing.
Sarah Schlitter, that's the key collaborator I see on the Kansas Department of Commerce.
Department of Commerce, yeah, is listed.
Sorry, I'm sorry.
That's okay. So we've got Housing and Urban Development and Housing Commission. And so we want to add Housing Authority.
Well, I would, for head, I think the housing authorities in each community, I don't know what the overarching.
Yeah, I don't
entity
either.
of that is. Yeah.
We have landlords with success in section 8. And Kansas County and geographic-based landlord associations, HOAs, neighborhood associations. Well, we'll just list them all. No, we don't lose anybody.
Annette Graham, K4AT,
Yeah,
Madam Chair.
Annette.
I think we also need to look at like senior-focused housing facilities. There's some, individuals who rent facilities for senior-focused housing is an important one. There's a multitude of those, and I don't know all of those. Like in our community, Mennonite Housing does a lot of work with older adults and people with disabilities. And then I think there's groups that do things like Habitat for Humanity that does build, but they're also very much getting involved with home repair, home maintenance, modifications. So I think those are all going to be a piece in this because you have to have affordable and accessible. And sometimes it's about home retention too. So when we work with older adults and people on low income, if they get behind on their taxes and things like that, they can lose their homes, and then they're often end up homeless. And we're seeing an increase in the number of homeless older adults because they can't keep up with their payments or they get behind. So I think it is important. I agree, it's very important, because housing usually is the one key factor. If you can't get housing, you're not going to remain in the community or be able to return. But I think that there's quite a list of entities, but I think like the Habitat for Humanities and some of those groups would be important to include, because they see it as well. They have a piece of this.
Okay, online we have Ernie.
Thank you, Madam Chair. Ernie Cutzley, AARP Kansas. Could we include AARP Kansas in the key collaborators, please?
Okay,
It's an issue that's very important to us that we're working on, so be happy to be there. Thank you.
so under key collaborators, we'll add AARP, Housing Authority, Habitat for Humanity. Did you say another one, Annette?
Mennonite Housing.
Madam Chair,
Would,
could
oh,
we?
Jan.
Thank you. Jan Kimbrell, KSHL. As you were starting to list individually those like organizations, like Habitat for Humanity or Mennonites, in our little area where we live, we also have Flint Hills Builders. So can the language be Habitat and like organizations, instead of trying to name all these other ones specifically, because each community, not every, but quite a few of us have that type of thing. And Flint Hills Builders is one that goes in and helps make homes accessible, does the repair for the elderly, and their criteria is for the seniors or handicapped who have no other place to turn for repair on their house. But if we could put other like organizations, maybe that would.
I was kind of thinking the same thing, that I was trying to think of an overarching description of those without listing the names. Does anybody have something? Lee, do you?
Yeah, thank you, Madam Chair. Would you just say community housing support organizations? Would that encompass all of them? Or local community, maybe?
Community housing partners.
Community housing partners?
Most of the time, that's
Does that
what they're
sound
doing.
good?
It's a partnership, I think.
Yeah, yeah. Camille?
Well, I'm kind of back circling around to that HUD, or Housing and Urban Development, is the overarching federal, I think, and I think we have in a Kansas entity, and I'm just sorry that I can't name, I'm looking and I can't figure it out. But it almost seems like where we're at on this is that we almost need to make a recommendation that there is this committee's brought together to figure this out. We don't know, and look at all of us. And it's an important thing. So I think that needs researched, and I don't know that we have the expertise sitting around the table.
Yeah.
Which might be part of our problem. Thank you.
Yeah, thank you. That's also what I was kind of thinking too when we were discussing that. Do these fall under any of those other organizations? So Camille, your suggestion, it would be that the group of key collaborators that are listed, that they form a committee to discuss.
To figure out who all should be at the table for this.
Okay.
So I think housing and urban development would be an overarching.
Yeah.
Yeah.
All right, so where are we at with this? Does anybody have a suggestion? Lacey, you look like you want to say something.
just in my Is there a need to engage with people like the Real Estate Association of Kansas? She read my mind.
So multiple people thought that. It's a good idea. I think it's called Association of Kansas Realtors, yeah.
Would it be appropriate to slide the words not limited to but including? Because someone's going to come up with, oh, well, they didn't list this, so we can't do it.
Hina, do you have suggestions for giving us some direction on this?
The intent behind the key collaborators is for the committee and work groups to really initially brainstorm a few to bring to the table. The action lead, which you have here is the Kansas Housing Resources Corporation, would be the entity responsible for bringing the groups together. And so we could add language at the beginning if you wanted, saying that key collaborators are those that have been brainstormed but aren't limited to that list. And can be expanded upon by the action lead, if that would be helpful.
I think that's exactly what we had in mind. Lacey?
And seeing that, I think we're talking about moving this to tier 1. Could we maybe also entertain the idea of in the hold on, I just lost myself here. In the recommendation, taking out the word encouraging collaboration and putting require collaboration and make it that the Kansas Housing Resource Corporation would be the party responsible for making that collaboration happen and including any other partners that they see fit to do their work.
Okay, do we want to use the word require? Is everybody okay with that change? Okay. So that's the only change, Lacey, on that require collaboration to invest in housing options? Okay. Lee.
Thank you, Madam Chair. Just point of clarification, when you require an entity to do something, doesn't that require, I mean, that seems to be more difficult. What has to take place to require an entity to do something? Just for my knowledge.
Normally it's an email for me, but
Okay, well,
It's probably different for different
I mean, so I think that the idea would be with that the legislature would require the Kansas Housing Resources Corporation to initiate collaboration and play out the recommendations that were given, I think.
so then just a follow-up, how does the Kansas legislature require them to do that? What steps have to take for that to take place?
Does it need to be a statute then?
That's what I'm trying to get at. If it has
Yeah.
to be a statute, that's probably going to be a little bit more difficult than, I mean, I don't disagree that it would be lovely to have them required. I just think, I'm just opening it up for discussion, specifically to the representatives and senators, if that's something the legislature would want to take on as a statute change, or if I'm just asking. Because require is a very strong language.
Is there a softer word we can use beside, something in between encourage and require? Recommend is actually a good word. Hina, can we call on you?
You took the words out of my mouth. Recommend is what I was going to go with. And the other thing is to stay in tune with the other recommendations. You could add legislature to the action lead.
Okay.
And then it's either a statute, an email, whatever correspondence the legislature would like to take in this entity.
Okay, so recommend collaboration to invest in housing options. We good with that? Okay. So back to key collaborators. I mean, I've written several down that I think that the point that Hina made of having a statement there that would be not limited to these, maybe with that said, maybe just we leave all those, the different housing groups that are listed and add AARP and then leave it at that. Annette, are you okay with that? Okay. So we won't list. Oh, do we also want to do the Kansas State Realtors, Association of Kansas State Realtors? Should that be listed there too? I think so. I think that it's a little bit different than. Yeah, Lacey has a question for Hina.
Is there a way to, like, maybe at the beginning of our report, kind of put that language of or any other collaborators as the action leads see fit, or to kind of give those action leads the ability to work out to other people and not constrain them, maybe because we missed a party or something?
Yes, there is definitely space up front. That was my initial suggestion, just to put it really up front in the language, so that as those that are reading this, I think we have a how to read this report box, you could just add it to that. Or how to navigate this report.
Okay, yeah, thank you. Thanks for that question and clarification. Okay, are we done with that one? All right, we were. Well, yeah, that's where I was trying to figure out when we went down a rabbit hole, how to get back out. So are we in agreement to move that to Tier 1? Any objection to moving that to Tier 1? Okay. We will move that to Tier 1 and appreciate the recommendation for that. That was a very good point. Okay. Hina, where were we on this? Oh, no, we haven't done Tier 3 yet. Okay.
Yes, we're still on Tier 2, and Tier 1, the table is happy now because every topic has a recommendation under it. So when we go to Tier 2, we were at daycare resources and then the Senior Care Act. If there are any from there that you would want to move up to Tier 1 or down to Tier 3.
Anybody see anything? Okay, I think we're good to move on.
All right, and then when we look at workforce, if you remember their prioritization, Tier 1 was around retention. Tier 2, the list of recs you see here are around recruitment. Any that you would want to move up to Tier 1 or down to Tier 3?
Lacey.
Just making sure I'm following. We are moving the recommendation 7.5 from the daycare resources box and combining it with 9.9, correct? Okay.
Correct.
Any other questions or discussion? Okay.
And then the last, you have the two cross-cutting recommendations around education training credits and caregiver services. Would you like to keep these here at Tier 2, or would you like to move them to either 1 or 3?
Does anybody have anything? Okay, we're good.
All right, then we move on to figure C3, which is your tier 3 recommendations. For work group A, there are only 2 in the preventing abuse, neglect, and exploitation. Are you comfortable with leaving these here, or would you like them moved to one of the higher priorities?
I don't see any discussion.
Okay. For the next working group B, you have a few recommendations. There are some changes. So if you look at daycare resources, 7.2 was moved up to tier 1. And then 7.5, as Lacey just clarified, was added to workforce. And so there are only 2 under daycare resources now at 7.3 and 7.4. Which would you like any 4 of those moved?
I think we're good.
All right, and then for workforce, there are 3 recommendations around training and around recruitment and really finding out how to eliminate barriers to entry. Any changes with these 3?
Haley.
Thank you, Madam Chair. I just have a question to Hina for clarification. Can you please remind us of the timeline of implementation? Tier 1 is within the next year, 2 years. Can you expand on that? Because if so, I may have a backtrack question for the group.
Of course. So tiers can be done by priority for your time frame. So tier 1 would be in the next year or 2. Tier 2 would be in the next 3 to 4 years. And then tier 3 would be the next 4 to 5 years. And then remember that each one of the recommendations also had immediate action and strategic importance. And so, for example, if you were in tier 2 and you were a strategically important recommendation, you're going to start laying that foundational groundwork 2 to 3 years from now. So it might not be implemented for 5 or 6 years.
Thank you. So I would like to backtrack. Not too far.
No, that's why we're having the discussion.
I'm slightly concerned on 9.7, which is on page 57. My concern is that if we leave it at a longer timeout timeframe, if we do, with the workforce, if we do end up increasing, reimbursement rates so that we can pay higher wages for the workforce, but then we don't have the trainers there to train them, are we really making a lot of progress? If we don't move that up higher in prioritization to address the instructor pay and benefits.
So that was 9.7 on page 57.
Yes. I would question to move that to a tier 1.
Okay, any discussion on that suggestion? I think it makes sense. Yeah. Yeah, Hina, okay.
I was just going to say that one of the reasons, Haley, that you had this at tier 2 was because of that downstream effect of making sure the reimbursement rates happen first, because it would be sequential with 9.7. So the committee can choose to put it up to tier 2, but just letting you know that's why, to tier 1, but letting you know that's why it was in tier 2, because you needed another action to happen first.
But is there a way to say that they would happen sequentially, but we still want it to be in, upfront in that first, what'd you say, year or two?
You could add it to the recommendation language of just saying, to recommendation 9.1 would need to be implemented prior to beginning recommendation 9.7, something along that line in the italicized text. We could work with KLRD on that.
Yeah, does anybody have any objection to doing that? Okay, I think that's what we want to do. To go ahead and move that to tier 1 with that language that, I can't remember the number, comes first.
9.1.
9.1 would need to be implemented first. So that's tier 1. Did you have any other backtracking, Haley? No, no. Okay, were we done? Are we okay on workforce then? We're on tier 3. Any discussion? Okay, Hina, I think we're good there. I've got a question on backtracking on page 21, the recommendation 3.8, funding CMHCs, and that's in tier 3. You know, this year, we passed that CCBHC bill that has additional funding in it. And I'm not on that committee, and I'm not familiar enough with what that all has in it. I mean, I'm somewhat familiar with it, but not all of it. And the other legislators here are also not on there. So I might look for some help to see if some of that isn't, if we're not recommending things that maybe we've already done legislatively. I'm looking at Jesse. I'll just give you some time to look at that because we. So I quickly read through what our recommendation is. I know it wouldn't address the senior care navigator. Using telemedicine. Yes, Lee.
Thank you, Madam Chair. If Jesse does confirm that funding was increased, there are several different recommendations in this that we have made that indicate, we say in the recommendation, this much money was given in this year, and then we move on to say, we recommend that a portion of that money be used for this. Could we, if in fact the legislature did increase the funding and they are receiving more funds, would it be more to say that those funds would be, a portion of those funds we would recommend to be used to have the senior care navigator position or funded into some of the geriatric programs?
Just so there's no question, but that the funding increased. But I think it draws down federal funds, and I don't know that's where I'm kind of getting out of my wheelhouse. I don't know that doesn't have to have some specific direction to it. Do you remember what CCBHC stands for? Lacey, can you tell us?
CCBHC is Certified Community Behavioral Health Center. And then, so then the question is on,
On funding and if there are, if the money is required to be directed at certain things.
for the CCBHC?
Yeah.
Yes. So the funding is to allow for the CMHCs to transition into a CCBHC, but that transition will, for many of the CMHCs, require them to expand the services that they provide because a CCBHC requires more provisions than most of the CMHCs were providing before this opportunity.
So what we're wondering is if the requirements there, if what we're asking to be expanded here isn't already being addressed in the bill that we already passed in that CCBHC funding. And see, we'll still have CMHCs, so.
Correct. I think, I don't know if Bill's online at all or not, but I think some of the conversation was around the idea of having funding to establish more CMHCs because establishing a CCBHC didn't narrow or increase the catchment area for any one CMHC. So allowing for more funding to increase the number of state licensed or buildings of CMHCs, that would be the mechanism that could then reduce the catchment area for each one that's established right now.
Okay. Hina, could you help us out?
I put my hand down because Lacey captured the conversation. It really was expanding that catchment area, but bullet point 1 is the first bullet point is the only one I wondered about.
Yeah, that's kind of what caught my eye. Lacey?
So the thing that would kind of trigger is if we did provide funding to make more CMHCs, I believe the way that the statute is right now, it would require them to become a CCBHC. I believe that was the direction we were given, and that is why all 26 of ours will become one, is because in Kansas, we said within our legislature that we will turn all of them into it. I don't know if, we'd have to look at the legislation to make sure that it doesn't say any of the current ones and it doesn't encompass future, but I believe any future ones would also be required to become certified as well, the way our Kansas legislation was written.
Okay, Jesse. Okay, it's a House bill, HB 2208 is the bill that where we passed the CCBHC. You know, I don't want to pass this. I think maybe I'll check with somebody when we take a lunch break that, not that I don't trust the discussion that we've had, but I just want to make sure that we have our language right and don't lead somebody down a path that we need to do something new. Haley.
Can I ask the question of what specifically defines and designates and separates a CMHC from a CCBHC? If anyone knows, phone a friend.
Well, that's part of the issue, Lacey.
So a CMHC is a licensure category for your state license in Kansas, such as you had a nursing facility in Kansas, but you were also certified and had a provider agreement with the federal government to provide services that they required. So the CCBHC is a certification status that a state licensed facility could get. Does that help? Yes. Okay.
So in comparison then, a CCBHC,
So a CCBHC would be comparable to the provider agreement that a nursing facility would have for Medicare and Medicaid services.
Okay.
you still have to have in Kansas a license to operate that facility. But if you want to do additional things like partner with the federal government for those funds, you have to be certified within their program.
Okay, thank you for that clarification. Hina, you've got your hand up. Do you?
If it's helpful, I think Lacey had brought up the conversation last time too, that the CMHC is like the parent term and CCBHC is a part of it. Is that still correct, Lacey?
Yes, and that is mainly because of the bill that was passed within Kansas that requires all of our CMHCs to become a CCBHC. So they could be separate, but all the current ones will eventually, those will be kind of a synonymous term, but technically they are two separate terms because one of them is revolving around the state government and state terms, and one of them is federal. So you can be two in one at the same time, I guess, but.
Okay.
Yeah, so like state licensed only versus federally certified. But I'm also reviewing 2208 to see how that impacts any future ones to make sure I'm
Okay.
not missing anything.
Okay. All right, let's flag that one to talk about after we've gotten a chance to look at that. All right, where were we before we? Hina, did we make it through the tiers?
We did. So the tiers have been finalized. It's if there's any other conversation on other recommendations.
I think at this point, I'd like to ask if there, as we went through these, we didn't ever, we at one point are going to vote on the document. Are there any of the recommendations that you see now that you disagree with, that you would like to not have included in the report? I think we've gotten pretty far down the road with it to where I don't think we're going to find anything, but I wanted to give another chance here while we're having some discussion.
Do you know if lunch is here?
Okay, I think that lunch is here, and I think we'll take a break and grab our lunches, and you can keep having a look at this and the document and see if there's anything else that you would like to have some discussion or changes. Lunch is been provided by Stephen Durst. So we can thank him when we see him. Okay, let's break. Okay, we'll resume at 12:15. Okay, we're going to go back to, we're going to go back to our discussion. When we broke, we were talking about the CCBHCs, and we had some discussion, we looked up the statute, had some discussion with Jesse and Lacey, and we think we're okay as is. That we, a lot of the discussion in the mental health arena has been around the crisis, focus on crisis management and on youth. And we think that these recommendations are more focused, obviously, on the senior issues, and that we are not really duplicating any language. So go ahead and feel free to keep eating. I haven't even started yet, so I'm going to try to fit some of that in. I was just saying I'm usually pretty quiet, and today I've been talking a lot. So we are going to need to approve this report of the working groups, which is going to be separate from the committee report. So the next, does anybody have anything that they thought of during lunch that they want to go back and address? Haley?
I'll give you a break to have lunch.
That's fine.
One conversation that was brought up, and I'm not sure where this would apply, how this would apply, et cetera, was if we're really looking to support seniors, keep them in their homes with resources, do we have anything within these recommendations or current systems that are in place that we need to utilize or promote more that allows for an individual to have a central point of contact either locally or in their area about resources available to keep them in their home? The concept that I'm thinking of that we were bringing up was back good old days, they used to have your local SRS office that people could go down to, walk to, that were very community-based, and those closed and were consolidated to your local DCF offices. I know that it was brought up in conversation too that the AAAs have a point of contact for that, but I know in my personal experience, it's maybe one person serving multitude of counties, and to be able to get in touch with that person or to hear back from them is a length of time that maybe that individual doesn't have the beauty of allotting. So I'm curious, just thoughts from General Committee, if there's anything that is in place that we don't know about that we need to recommend maybe promoting more so, or if we'd want to do anything with that.
Okay, Jan?
Yes, in that conversation that we were having over lunch, I mentioned that in our area, we have a council on aging that advises the senior centers in our county, of which we have 2 that are involved with AAA. And we're adding a senior care coordinator that will be funded by our county council on aging for this very purpose, because in our county, we don't know where those services are, and people are very reticent to go into the more, quote, professional buildings if they knew where to go. But in the senior center, they're more comfortable, and there's more of a conversational tone, and they will come in, and we're putting in a private office space that they can come in, and the conversation can be confidential. But that's in our county because we don't have the type of service that in the larger community is readily available. It's not available, and our AAA group is not able to provide that for us locally. With the site managers that we have in place, they don't have the information. But we feel that there is someone we can hire whose position will be to know, it's not a degree required position, so they'll pay, but they can find out who those contacts are and be that source. But we're going to fund it. And so I don't know if you can make a recommendation to counties to look more closely at their community to see if they have someone that can be that person. But we've looked and we don't, and we will. So that's where we're going with that.
Well, that's very progressive of your county. Yes, Annette.
Okay, so this is a common issue. People don't know where to get started. They don't know what services are out there. They don't know where to start, and they don't even know what questions to ask. So the state funds through the Aging and Disability Resource Center contract a statewide call center. It is a simple number. It's a toll-free number that's available to anybody. It is staffed 8 to 5, Monday through Friday, and then people can also email, they can do chats online, and then they can leave a message, and then someone will get back with them. That is staffed by professionals that know about aging and long-term care issues. It's for anybody seeking supports and services for long-term supports and care. So it's disregarding income, age, disability, anything. Now, what that call center does, it's through the Area Agency on Aging, through my office, but it is a statewide resource. And when we get calls in, if they have, we give them the information, but if they need more specific based on the Area Agency on Aging service area, then we do what we call a warm transfer, where we get all the information, we call the other office with this person, on hold, and say, this is what's going on, these are the issues, so they don't have to repeat their story again. So the beauty of that really is, it's really, really hard to get 105 county numbers out there. So the goal of this is to get one number, keep it simple, and you can get that out. It's not been marketed very well. KDADS was in the contract, was going to market it, but that hasn't happened very well. So we are working through multiple venues to try to get that out there more. We worked with our transition programs, so we talked to hospitals and nursing homes. We're in a collaboration right now with the APS and doing some work to get that information out and to help seed that. So it's something that we're continually trying to do, but if that could be something through this committee to help get that word out there, because you just have to get it on all kinds of platforms, because it's the older people themselves, it's their caregivers, it's younger caregivers, it's the neighbors, it's other nonprofits. We get lots of calls even from professionals who don't know where to go. So, that is a statewide aging and disability resource call center number.
Okay, we'll go to Hina online.
Hina KHI. I just wanted to refer the committee to recommendation 6.2, which is promote home and community-based services, and consider expanding that language if you wanted to add anything. It does reference the resource center and really promoting awareness of that, along with a few other bullet points like explore your options, resource guide, a mapping tool, and such.
Okay, Ernie, did you have a comment?
Ernie Kesley with ARP Kansas. Yes, I was going to suggest that or recommend that. Thank you, Hina.
Okay, Haley, did you have any follow-up? Does that meet?
Yes, I would like to include some sort of language in there that includes the promotion of that service and that resource. I don't know if it's...
So would that be something, since this is the work of the working groups, would that be something that we would add then later with our report?
You could make it as a recommendation from the task force.
Yeah. Well, so we'll bring that up here in just a little bit as a recommendation from the task force. And then just keep these based on what we have, unless you wanted to amend one of these.
I think that was possibly the intent. If it really
Okay.
goes along to maybe amend 6.2 to include this, rather than a whole entire separate recommendation,
Okay.
if that makes sense.
Perhaps if we add.
So what language were you recommending? Under one of the bullets of the recommendation? Do you have a suggestion of what you would want it to say?
Annette, what is the name of that resource?
We call it the ADRC Call Center, Aging and Disability Resource Statewide Call Center, or Resource Center.
Is it already in there?
Oh, yeah, bullet point 3, marketing.
Okay. Then,
Okay,
And then we can include the phone number, 855-200-2372.
okay.
Madam Chair, if we added the word under bullet point number 3, improve the marketing, as obviously it's not marketed consistently across the state and into the communities. So, I mean, I could see the first response being, we already do that. Well, we don't do it well. And so if we could say improve,
Okay.
be helpful.
Any other discussion on that one? Haley?
is there already funding you stated that was allocated to do so via KDADS? I was just curious, what will it take to market that better than what it has been done, was my question.
Yeah, maybe we could ask KDADS to put that in their budget and make a request.
Who's action leads, legislature?
Oh, I have KDADS.
Can we add the legislature as an action lead?
Well, if it requires appropriation.
That's my question.
Yeah,
Because otherwise, it does appear that the language is already inclusive of it, so it wouldn't need to be another separate bullet point. I'm just wanting to recommend it be adequately done
Okay.
and promoted.
oh, let's just say improve marketing, and we've got, if we put KS Ledge as an action lead, then with the tag on it that it requires appropriations. That should do it. Any other discussion on that one? Yes, Senator Pag.
Thank you, Madam Chair. One thing, when we say marketing, I know in Butler County, they got a newsletter for seniors. If there was a nice article that could be made up that would get to every little senior newspaper around, I would think that'd promote the discussion with that, because when you can spend a lot of money on marketing and you're not hitting your target. So just be careful of that. That's just my opinion. Thank you.
Okay, thank you. Lacey.
I was just gonna say, I think all of the AAAs have some sort of mailer that they then mail out to most of them. So maybe that's something that the AAAs could be putting in their mailer bi-monthly or however the frequency we think necessary.
Ernie, online.
Yes, thank you, Madam Chair. You could also include AARP Kansas, the key collaborator there, please.
I'm sorry, I missed what he said.
I'm sorry, Madam Chair. You could also include AARP Kansas as a key
Okay,
collaborator.
as a
please.
key, okay.
you.
AARP as a key collaborator. Senator Pag.
Thank you, Madam Chair. Do we have any idea how often that number gets used at this point? I mean, how many people man those phones? How busy are they?
We do provide KDADs, and we do keep records, and we provide that information to KDADs about the average monthly calls. We also included our executive director for our state association includes that in and reports to the Bob Bethel Committee, and when she presents to the legislature, she includes that information. We do put that information out through the area agencies on aging. In our area, the active age hits about 80,000 readers. We include that information in there. It's always, the challenge is until you need the number, you're not really going to pay attention to it. So it really is a matter of repetition and keep making sure that that's out in front of people. I kind of likened it to when you're going to buy a car. Before you are interested in buying a car, you're not really paying attention to what's out there in the cars and what those cool new features are. You're not interested until you're ready to buy a car. And it's kind of the same thing when we want aging services. We're not really out looking for services for ourselves or our older relatives until it's a crisis. So it really is a matter of getting it out there, repetition in lots of different places. So I agree, it's not always those commercials and more expensive ways. It's just making sure that it's in key places and key social marketing networks, those kind of things, and websites. But yeah.
I notice under the key performance indicators, the second bullet has increased calls to ADRC call center. So that would indicate that we are tracking it, and that will be a sign of success, I guess. Senator Fagg.
Thank you, Madam Chair. One thing that crosses my mind is a senior citizen talking on the phone. That can be an issue. So I don't know the answer to that, but it would be better if it was a one-on-one type of thing somehow, just a thought. Because I have trouble, with, we know how the phone systems work today when you try to get into a big business somewhere. And I'm not saying that's the way it works, but because of hearing issues, it's just how we approach this is just a thought. Thank you.
So we have the call center, but each of the 11 area agencies on aging also have a physical location. So if people need to come in, they can go into each of the area agencies on aging and talk to a person one-on-one. That is available.
Thank you. And that's kind of the information we need to get out. Yeah, okay.
And did you say there was email as well? Or
We have a chat feature on the call center so that people, a lot of times we're dealing with caregivers and people that are really busy, and they might just want to send use that other platform to chat and ask questions and get feedback.
Okay. Yes, Haley.
Annette, I just had a question on that. Do they ever disperse any contact people to visit those individuals in the community? Because I'm sitting here thinking in my community, my local AAA is an hour-and-a-half drive away. So that's not necessarily accessible for some, elders in our community.
The majority of services are designed to be in the office or on the phone or on the electronic platform. And a lot of the AAAs that have a bigger area do have some satellite offices. And then there is sometimes options counseling. So if they need a more in-depth discussion, and so it's the kind of higher intensity levels of option counseling that could be made available to people in that format.
But I see what your point is, Haley, because I contacted the Flint Hills Area Agency on Aging when my mom was needing some services, and that's an hour and a half away. And then her caseworker, maybe, I don't know what her title was, came from Salina, which is an hour away. There just wasn't anyone, thank goodness she had me to advocate for her. But I think the idea of having somebody in your community, the thing is we could make a recommendation as far, but on the state level, we don't usually make a unfunded mandate to a county, so.
Well, in our area agency on aging is in Manhattan, and we meet monthly as a council on aging, and the representative is there, and we discuss with them the issues that we're having in Morris County, and they provide the information to our senior site manager, who could then give out the information locally. But that's a lot of hoops to jump through, and people get lost. So we're gonna establish somebody that in that senior center, that this is where you come to, and she'll jump the hoops and get the initial information. But the Area Agency on Aging ADRC person is vital to that. And we're this new position will be the one that makes that initial contact to take away a little bit of the scariness of that if you're trying to figure it out on your own, or your family member. But it's one of those partnerships that we're trying to put together. And we think it's going to benefit the seniors and senior families that have to come up with this. So, but we're trying to make that partnership with Area Agency.
Okay, is there anything else we want to add on this? Representative Owsley, did you have anything? No, I didn't. Okay. Sure, yeah. Leanne's going to share the call data.
The ADRC statewide call center received 26,605 calls in 2021 and 24,684 calls in 2020.
Yes, Haley.
I think if you look at those numbers, those are pretty darn significant if even a percentage of those need a higher level of dispersed support. And I don't know if this is the appropriate time, so you need to tell me if it's not, but would it be worth considering through this task force, and I don't know the appropriate means or process of there being, taking a system that we already have in place and providing additional supports, additional positions to that to span that service out on a more local level. Because like I said, my local is an hour and a half away. What it used to be when we had the local SRS offices was a half an hour radius.
So this would be the right time if you are making a recommendation that would go into this one. But we could hold it for a committee report too. What would be your preference? Or the committee?
Hold it for committee possibly, because I'm not sure if it
Okay,
fully ties in with this or if it's a separate.
okay. Well, we'll hang on to that then. Any other discussion on specifics on this report? I have one, but I lost my page number. Oh, I know, I wrote it down. On page 19, we have the recommendation for Charlie's bill. We do not have the report back from the Judicial Council. They are doing a study on that issue of appealing involuntary transfers and discharges. And I had asked if they could give us some kind of an interim report, but they're not ready to do that yet. They've still got a couple more meetings, and I don't think they'll be done till the end of November. I don't feel comfortable including this one at all. And I'll welcome some discussion, but we have had this in Children and Seniors Committee. It's been discussed extensively for 2 years, and because we didn't know what to do with it, we wrote a letter to the Judicial Council and asked for a study, and that is going on at the present time. So I guess I'm making the recommendation that we remove 3.5. Is there any discussion on that? Representative Owsley.
Thank you, Madam Chair. I would agree with that opinion, and I'd also think that committee's recommendation was to have the task force look at it. The recommendation was to have the working group look at it. So I believe the recommendations have been completed, and I agree, waiting for that report to make sure. It's just a complicated situation, and we want to make sure that we get it right, and the most information that we can have is not available yet. So I'm supportive of not including this at the moment.
Representative, Madam Chairman?
Jan?
Would it be appropriate then that we have an appendix back here for other recommendations that we take, if you're saying you want to strike Charlie's bill, that's shorter language, but we move that into the appendix where a task force thinks it's a good idea, but it's just not ready yet, so that it's not forgotten, that it could be included back there in, I think it's Appendix D, where it says other recommendations. Would this fit that way or not?
Hina, are you online?
I am, Madam Chair. And that is where the recommendations, Jan is correct, that's where the recommendations for further consideration have been placed.
Okay, so that would then give the opportunity for us to reflect the work of the working group, because we had asked them to look at it. Okay, thank you. Representative Esau.
Thank you, and I think that might be the best way to go, because no one who's currently in the legislature that's looked at this is wanting to not do something about it. We're not going to forget, but we want to make sure that the legislature is aware that the task force did look at it, and we're not ready to say what action you might want to take, but continue looking at it. Hopefully we can come to a resolution when we get more information.
Camille, online.
With the discussion that just occurred, I absolutely agree that as long as it is placed in that list, that we indeed do, we aren't ready to make the exact recommendation, but we recognize that it's important and that it stay on the radar. Thank you.
Yeah. Thank you. You serve on that Judicial Council Committee, don't you?
I do serve on that, and I do believe we'll get a report. We just didn't get it to you yet.
Yeah. We talked to the chair, and they just weren't ready just yet. Thank you, Camille. Okay, so is there any objection then to moving that to Appendix D? Okay, that's what we shall do. Anything else? Okay, we'll call on Hina, and she's going to talk about 6.3 if you want to turn to that.
Yes, this was going back to Haley's comment. If you take a look at 6.3, if you wanted to borrow some language or expand on that recommendation, under ease of implementation, it talks about adding case management, so more local services. To the ADRC, that's what would be under that transition services recommendation.
Okay, thank you. Okay, we ready to move on? Haley, are you good with that? Okay. Any other? That's okay. I just now noticed Jen waved. Well, it's good to see you. Okay, so I think at this point, Leanne, would you discuss the process of what we need to do next.
Sure, Leanne Thone, KLRD. So the task force needs to approve the working group report. This can be done in different ways if you prefer. It can be accepted or approved as it has been amended up to this point as a whole. If there are any parts that people want to pull out to vote on separately, that is also an option, I believe. It just sort of depends on the preferences of the task force. Once this is approved, this will be an attachment to the report of the task force to the legislature. So that is a separate report from this. This will be a part of it, but there will be a separate report from the task force to the legislature. The task force can make recommendations then to the legislature that include all of these recommendations. If you prefer, you can choose to emphasize certain ones. Maybe you want to say, you want to pull out tier 1 or something like that to recommend action in the next session. You can also make recommendations that are separate from this report. So if there's something else that's lingering that you feel is important to mention, maybe something that didn't clearly make it into this report, but you also feel is something that this task force should discuss or recommend, that's also an option. Is that clear as mud?
Yes, thank you for that clarification. We'll be here till 7 o'clock tonight at that note. No, I think we can get through this. So the first item then of business is that we need to go through, that we need to approve this report. And I think, well, I'll let you guys tell me how you want to do it. I'm leaning towards we need to maybe go through the sections of it. Although we have gone through and had a little bit of a review by looking at the tiers, but it's been a while since we have looked at these, and I think it took us a while to get moving even this morning. So I'd like your opinion. If you feel comfortable adopting it as a whole and trust the work that we've already done, I can be okay with that too. Yes, Lacey.
I apologize for not bringing my notes from last time, but I do believe the last time we met, we had made notes on individual items that we wanted to pull out. Is there a way to maybe review those items that we had already notated that we wanted to consider separately?
Those were just those 3 that we talked about this morning. Want to talk about them again?
No, I thought there was more, I'm sorry. I thought we made notes on more, I'm sorry.
To me, that we didn't have any discussion this morning, and they seemed pretty clear cut. But at the time when we were going through them, we were struggling with approving them. So, well, let's look at 1.3. Education training credits. I remember having a lengthy discussion about that. We did clean up the language quite a bit by adding the provide standardized training.
I think maybe Camille was on more of the opposing side of changing it from required to provide, or had kind of started that language. And I think maybe some of the providers had said, well, there's already so much education. Do we have to say require? So I would say if both of those parties are amendable to the changes that were made by the words that were put in there today, don't argue.
I'm not, yeah, I guess I'm not asking for trouble here, but why not? Okay, Camille, we'll call on you.
Thank you, Madam Chair. I actually, that's really where I was at, is that I had a stance on that, but the fact that they took required out and just put provide, it seemed like that was a reasonable balance there. And so I would hope we could just move forward with it as is.
Okay, thank you. Oh, Jamie, we haven't heard from you yet today.
Yes, Jamie Getting with Alzheimer's Association. I'm also good with the wording as is with the dementia training. So I'm happy with that.
Okay, thank you.
The only thing I would add that the committee discussed last time was that 12-hour requirement and adding hours to that, and I believe that was resolved.
Oh, yeah, I remember that discussion, yeah. Yep, okay. All right, and then let's look again at 3.1. Page 15. And that one is the Workforce Clearinghouse. Do you want to talk? Haley.
I think the biggest thing, if my memory recalls, was on the back part under the recommendation where we struck while prohibiting direct care resident care until background check results are available, because we talked about the workforce shortage and how sometimes if there is a license under investigation, that can sometimes create problems where if that person's found, like a nurse's license or something is being, investigated, that can prohibit them from working during that time. That could be a detrimental recommendation.
Okay, I was trying to figure out where you were. You're on 3.2, aren't you?
No, 3.1, I'm on page
3.1.
16 on the back. Oh, no, you're right, that does tie into it. Never mind, I'm sorry.
We can talk about 3.2. I'm happy to talk about 3.2. Lacey.
I will say, I think 3.1, I think we're good. I think I was the one that had some issues, and that was, I needed someone to tell me about the alert system at KDADS, because I thought I would know about it, and we struck it because that doesn't exist. So now that we have that out of there, I think we're okay.
Okay, yep. All right, we're good on 3.1 and 3.2. Okay. And then the only other one for discussion was, we've already taken care of, that was 7.5, yeah, combining with 9.9. Okay. What do you feel like? Do you feel like you need to go through it, or is somebody ready to make a motion to adopt the report? Senator Fagg.
Thank you, Madam Vice Chair. 6.2, I hate to go back to that one. I just need a quick question. The 11 planning and service areas, how did they decide on 11? Was that on population or how did they set those up?
KDADS designated back in 1973 what the planning and service areas were going to be. Originally, there were 10, and then at some point in time, Johnson County became its own area agency on aging and separated, so that was added as the 11th one. And I don't really know how KDADS decided, but that was as a result of the Older Americans Act in 1973, established authority for local area agencies on aging, and then federal dollars then are channeled down from KDADs to the area agencies on aging, and that funding is allocated to the 11 area agencies on aging based on a formula that's approved by the Federal Administration for Community Living, and it looks at population, the age groups, and it looks at income and minority. So it is a formula that's revisited every 10 years when the census data comes in. But it was based at that time how KDAD determined the geographic areas, and they vary significantly. We've got Johnson County with one county, but has the largest aging population in the state, numbers-wise. And then I think the largest geographic one might be the Dodge City area one that I believe has 26 counties. But the population is, different. So we range in size from one county to, I believe the largest one is 26 or 28, but.
Okay, any other questions? Oh, Rachel, online.
Madam Chair, I think that you called for a motion, and I would move to approve the report as we have revised this morning.
Okay, got a motion to approve the report of the Senior Care Task Force Working Groups, second by Jan Kimbrell. Any further discussion? Okay, all in favor say aye. Opposed, no. You guys are very quiet, but the ayes have it. And the report is approved, and thank you all so much. This has been months of work, and I really very much appreciate it. Okay, so now, next thing we will do is have some discussion of any items that we would like to have included in the task force recommendations in our report. Haley, no? You kind of looked at me like you wanted to say something.
I think this is then maybe the appropriate time. Hina had recommended, 6.3, the transition services, where it already is in the ease of implementation on page 36. The considering a program overhaul, we're adding case management services would be a new addition for ADRCs. I guess I would question the thought that was coming up as you were talking about that, that there's 11 AAAs in the state, and that has been determined 10 years ago, over 10 years ago, like the allocation for that population. My immediate thought was, wow, population has changed a lot. The needs of seniors in Kansas have changed a lot in 10 years. And, I guess I was thinking too, between Senate districts and representative districts, like the seniors in my area where I'm at, we don't even have a local one, like physical location in our area. Go ahead.
Okay,
Annette?
so when I talk about the allocation process that KDADS does with the 11 area agencies on aging, that is looking primarily at the federal funds. The federal dollars are allocated, and it is based on census data. So that's what they have to use, and the Federal Administration on Aging requires that they look at that. And then there is a funding formula that has to be established by the state and approved by the federal government for them to use to allocate the dollars to the area agencies on aging. So it is a formula that looks at number of older adults, 60 and older. Then they've also included the number 75 and older. And then they look at minority and low income. So all of those are factors that are considered in allocation of federal Older Americans Act dollars. So it's a formula that they developed, and when they change it, and then there's also some accounting for the rural and some base funding, because even though the demographics shift over time with a larger number of older adults in the urban areas, you still have a percentage of the whole population of older adults in rural areas being a higher percentage of the total population. As we know that the shift in population, people move to urban areas. But so there's some consideration of a base funding for rural areas to account for that. But that's required every 10 years, and it's based on the census. And when the final census data is provided to the state, then they use that. Senior Care Act is state dollars, some federal dollars, but they also have an allocation process for that they have established, and it's based on population and other factors. So that's how they do that. And the Area Agency on Aging, like I said, started in 1973 when the federal government had established that there would be area agencies on aging across the entire United States because of the realization that the needs of older adults really are locally based. And so you need an organization at the local level that is kind of builds that budget and service provision based on the needs of that local community, because each community, as Jan has talked a lot about her community and senior centers and the rural areas and the different services that are available. So the services in my area, which is Butler, Harvey, and Sedgwick County, are very different than what's in a rural area, but all of those things are taken into consideration at the local level as they determine how their budgets will be expended under Older Americans Act. That's a long answer, and hopefully it gets to what you were speaking to.
Yeah, no, my concern is just, that if that's determined, you said every 10 years, that's concerning to me. And also, looking at, like you said, the local needs based on what there is. Yes, a lot of older people seem to move towards that urban area, but I'm questioning, is it incentivized to move to that area because of resources, because there aren't those provided in more rural and frontier areas?
I will just say that each area agency on aging is required to do a needs assessment. It's usually every 2 to 4 years that the state requires that the area agency on aging does a needs assessment of older adults in their planning and service area. And then that information is used to help determine how those federal dollars will be expended to meet those specific needs. So yeah, it gets complicated, and definitely populations change.
And I'm thinking that this might be more of a local issue for the counties to address. I understand the point you're making, although the 10 years seems to go really fast. It does with redistricting. Do you have anything further?
I guess I was just, questioning whether it's something that we wanted to bring up as an issue or not, to give any sort of recommendation or guidance for more services and supports.
Well, I mean, if you've got some language that you want to propose, that would be, that would be great. I think that that senior count book might really have an impact on this as well. Hina.
Thank you for bringing that up, Representative. I know that you have approved the working group report, but there were 2 things that Haley had brought up last time regarding the elder count book. One, considering biannual dissemination was one part of it. And then, of course, there was a note made about needing broadband before we can expand any other things.
So those are things that we might want to consider putting in our report. Okay. Does anybody want to propose one of those in the form of a motion?
What number is that on?
Hina, what number was the Kansas, or the, what was it called?
8.3, the elder count book,
Yeah, the elder count.
that one's 8.3. If I have the correct version, it's page 49. It starts on page 48.
Yeah.
And so you have biannually put into there, just so you know, that was noted.
So we have that in there. So
Right,
when-
that was a change that was discussed last time.
Yeah. Yeah, I'd seen that before. So what, are you saying that we need to have that as a recommendation from the committee as well?
Madam Chair, you are welcome to use this report as a wraparound report, similar to what the Special Committee on Mental Health Modernization and Reform had done, or you can have a separate set of recommendations from the task force. I think that's how it was done from the Child Welfare System Task Force, where they tiered the recommendations and then had the working group report as an appendix. It's the will of the task force, how you would like to use the reports.
Yeah, so that's I think that's what the direction we were headed. But I was just asking if there were any recommendations from the task force that we wanted to put in our report. Am I not understanding that right? So that's already in there biannually. Yeah. Rachel.
Madam Chair, I'm really interested as a layperson in hearing from the legislators as to what format they would find most useful in studying the information that we've compiled. What is going to be the most effective way for us to communicate our work as a task force to the legislators?
Well, I'll just speak for myself that I thought that the Child Welfare Task Force, it would be a great model for what was easy to use, and they were tiered, and I mean the report is what it is, but then we also had a tiered list with bullets under it, and I don't. Any of the other legislators want to speak to that? Yes, Senator O'Shea.
Thank you, Madam Chair. Yes, bullet points, and then like just exact, like this needs to be a bill, this needs to happen first. This needs to be another bill, this needs to happen second. Just like exact. There's too much to read all the time, so less is more.
Yeah, and the direction on the appropriations, which items need appropriations. Does that help, Rachel?
It does very much. Thank you.
Okay. All right, there seems to me like I've got something dangling out here that another item that we hadn't addressed yet. We talked about the elder count book. Hina, did you bring up another issue?
No, when I checked back at the notes, there were no other outstanding issues.
Okay, so we've approved this.
It will be included. It's up to you.
So, yeah, Leanne?
The report will be included as an attachment to the task force report to the legislature. But the format of that report typically has a page that bullet points recommendations from the task force to the legislature. So if you wanted to emphasize any of these recommendations or make a bullet point to recommend the recommendations of the working group report or something along those lines, that would just emphasize that as a recommendation from the task force, if that makes sense. It gets a little layered. But yeah, so you could recommend all of these, or you could pull out specific things if you wanted to, and you can also bring up other recommendations that are not included in this report if you so desire.
And we could make statements like that we would like to see Tier 1 addressed in the 2023 session. You know, going back to Rachel's request, another thing that besides the way the report looks, that it's with the Child Welfare Task Force report, it was very, very helpful when they came to committee, was it Hina? Did you come to appropriations and other associated committees and went over the report with us? So that was real beneficial. So it's nothing that we need to address right now, but I just wanted to add that was real helpful. So with that said, what Leanne just shared about, you know, how we can address our report, is there some language that you want to say to prioritize Tier 1 or? Yes, Annette.
Yeah, I like your recommendation about taking action on Tier 1 in the 2023 legislative session, because I had wondered really about how this would be utilized. You know, I would hope after all the work we've done that it doesn't just become a report that sits on a shelf somewhere. And I would hope that some action is taken. So if we could make that recommendation that Tier 1 gets worked on during the next legislative session would be very important. And I think it highlights the, and values the work that has been done and these recommendations with it. That's kind of a strong message.
Okay, do you want to put that in the form of a motion? Just say.
Yes, I would make that motion, Madam Chair.
Okay, so it's been moved to ask the legislature to move on Tier 1 action items in the 2023 legislative session, however you want to word that, and seconded by Jan Kimmerell. All in favor say aye.
Aye.
Opposed, no. Okay, great. Ernie, do you have a comment? Oh.
I'm sorry, I was voting yes.
Okay, thank you.
Sorry.
All right, we got you. Senator O'Shea.
Thank you, Madam Chair. I think my only reservation, or I still vote aye, but sometimes the legislature's in charge of moving something forward, and sometimes it's other groups. And so how do we help hold the other groups or other stakeholders accountable, just as you hold us, the legislature, accountable? Something to think about. Thank you.
That's a good point. And we've got stakeholders in the room that, you know, I see this as a working document. That when I came as chair of the Committee on Children and Seniors, the Child Welfare Task Force had just finished their work, and that I just took that report, and that became my roadmap. These are the education sessions that we want to have. These are, you know, this is what we want to learn about. This is the legislation we want to propose. And so that's how I used it, and that's exactly why we proposed this, this task force, so that we would have some direction on some of the senior issues as well. So I don't see it being set on a shelf. So. Haley. Oh. Haley, go ahead.
So that was kind of my question is, if I understand we got to start somewhere. Obviously, we start tier 1. So then what happens to our tier 2 and tier 3 recommendations? Because if there are things that we realize are going to be, you know, a 5-year process, the sooner we get started on them, the sooner they can be. But does that mean we work on tier 1, and when tier 1's done, then we move on to tier 2? I mean, I don't understand that process, so I guess that's where I would like some clarification, or is that to be decided by us?
Leanne.
I just wanted to note, if this is helpful for sort of thinking about how this is going to appear in the task force report to the legislature, I was looking back at the Joint Committee on Child Welfare System Oversight Committee report, and those recommendations are broken out into recommendations, which are things like directives to agencies and stuff like that, and proposed legislation. So bills that would need to occur. And so those things are broken out and kind of help clarify who would be taking action on a certain recommendation, if that's helpful to think about.
Yeah, I guess to respond to those out years, there's nothing that we can, well, I shouldn't say there's nothing that we it's going to take personal responsibility on this committee, this task force, and the committees that are assigned with the legislature. Of course, we won't know that till later in the year, till the end of the year or 1st of January, what our committee assignments are. So that's very fluid. But, I can just see this as a committee chair, as a strategic plan, and to be able to move things forward that way. And, maybe you guys as stakeholders could participate in that, in keeping that moving. But that's just part of having the legislature and the amount of turnover that we have, and, especially on the House side. And we'll have a change in leadership, we'll have a change in chairs, and you can put a lot of work into something and the next person not have anything to do with it. And that's just the nature of the beast. This task force, it ends at the end of this year, I believe. Right, is that correct? Or don't we end at the end of this year? Yeah. So this is our last meeting. So if you have something else to say, this would be the time. Representative Owsley.
Thank you, Madam Chair. While we're on that subject, having served on the Child Welfare Task Force, and then serving in the legislature afterwards and seeing the legislative, recommendations and all the work that went into it, and then seeing the inaction by the legislature, was rather frustrating. But again, directors of organizations, stakeholders, it is a strategic plan, and for department secretaries as well, because when I go back and I look at that report today, that's now, 3-4 years old, a lot of it's been done, and a lot of it was done without the legislature, acting. I'm currently serving on the Johnson County Commission on Aging, and we just put together our legislative platform. And, 2 of the top priorities there were medicinal marijuana and Medicaid expansion. And I'm like, look, those are great ideas, but you got to talk to some senators. And, but it is by design, so try not to get too frustrated with it. And I appreciate all the work that went into it, and we'll certainly not put it on a shelf and let it collect dust, so.
Yeah, I've got Annette next, and then we'll come to you, Deb.
So just for clarity on the logistics of this is our last meeting. This will be a document that is then presented to the entire legislation, to the legislators. How does that happen? What's the process for, how does this report and strategic plan get presented to the 2023 legislators?
Leanne, you want to address that?
Sure. KLRD produces interim reports that are produced by all of the interim committees. There's usually a main volume and then a supplemental volume, and those go out to all the legislators and include the report and then any attachments. So things like the working group report.
And some people do, it's our responsibility whether we read them or not. I maybe don't get to all of them, but I read all of them that have anything to do with any of my committees. And appropriations kind of covers everything. So if you're on appropriations, you read it. Arida.
I would add, in addition to that, some of the reports have language that indicates that the report be provided to specific committees. And so then we send those reports to those chairs to draw their attention to the report, and often then present the report to that committee sometime during session.
Okay, I had Deborah next, and then I saw a bunch of hands.
Need to push this. So we were talking about holding other stakeholders accountable to participate in the movement of some of these recommendations. I think it's really good that we have a list of collaborators with each of the recommendations. And some of those collaborators know about that they're in the list. Some don't. And so there will need to be, by someone, a process to communicate to all those collaborators that are listed that they're involved in, they should be involved in the process. So I don't know whether legislative research or who would furnish a report to all the collaborators that are.
Okay, Arida.
I think how it's typically been addressed is that the lead agency would be responsible for reaching out to those key collaborators, making it known that they're part of that group and seeking their involvement.
Good, thanks.
And that was a very good point, yeah. I'm sorry.
KDAS will just take out an ad then.
Yeah. Let's see, Haley, I saw your hand.
Yeah, so I had two questions. One of them is, so then would it be beneficial to place a listed committee attached to each tier one recommendation? Is that kind of what you're saying for the direction of it? I'm just really, looking at, we as those who are not directly in legislation, how do we best continue the ball rolling? Like, we have personal accountability. What does that look like? How do we take that? Do we take these recommendations and take them to our own, senators and representatives, but they may not be on the appropriate committee? I know of one committee that mine was on that I think some of these would apply to, but not many. So I'm just wondering what that looks like.
Rita?
Typically, they've not selected the committees to send them to by tier, but the entire report would go to select committees. And not all of the recommendations might apply to all of the committees. So if there's certain ones that you feel need to address and take a look at the report, then include that in that list of those that might be able to act upon it or have impact on some of the recommendations. Does that make sense?
Ernie, online.
Yes, thank you, Madam Chair. I was wondering, of course, I was looking at 1.1, the statewide aging conference, as a way to update and inform people. But I was also wondering, with the end of the task force coming up at the end of this year, if there's any thoughts around somehow extending, or not perhaps extending, but putting into place some group that would look at these recommendations on an ongoing basis that could be updated, revised, with some kind of interim report. Thank you.
Well, okay, thanks for that comment, Ernie. I think that that would be a great idea if we had some kind of process in place. We were just kind of having a sidebar conversation here about doing roundtable discussions like, they've done in Health Committee at times. And I could say, yeah, I would do that, but I have no idea what my position will be in January. So, I think that we all need to stay in touch, and if that's a possibility, then we'll do it. But or maybe make a recommendation to whoever is chair of the committee. Yes, Lee.
Thank you, Madam Chair. Lee Chaffee. I did want to point to our Tier 1 recommendation of 5.1, the State Advisory Council. If that does go to fruition, that would be a council that would continue to look at these issues on an ongoing basis and continue to keep this to the forefront. And that advisory council could keep people at the table if that's something that comes to fruition. My second point would be, again, the personal responsibility. All of us in this room are advocates. We are very involved in policy and really involved in serving seniors. We're passionate about this. We have this report. We can reference it at any time when we're talking to the legislators, the committees. If we get the opportunity to testify, we can reference this. And I do think it's our responsibility to do so for the seniors of Kansas.
Thank you. Yeah, well stated and good points. Okay, anything else? Okay, we haven't approved our report yet, have we? Okay. Sorry. Yeah. So I would entertain a motion to approve the report of our committee. Yes, Lacey.
Madam Chair, I move that we approve the report from the Senior Care Task Force.
So it's been moved by Lacey to approve and second by Senator O'Shea. Any other discussion? All in favor say aye.
Aye.
Opposed, no. Okay, the ayes have it. We approve that. The next order of business is the minutes of the August 24th and 25th meeting. Those were sent out. I hope that you've had a chance to take a look at those. If you need a few minutes now, we can do that. Or if not. Okay, so they might just do. Okay. So we have the minutes that were emailed to you are the ones we're approving, not the ones that were on your desk. Okay, are there any additions or corrections to the minutes? Okay. Is there any objection to letting them stand approved? Okay. Do you need a motion? I do. Okay. Lacey.
Madam Chair, I move that we approve the minutes from our previous meeting in August.
Okay. Okay. It's been moved by Lacey, second by Haley to approve the minutes. All in favor say aye. Aye. Opposed, no? Okay. The minutes are approved. Lee.
Thank you. Will we all get a copy of the final report that will be provided to the legislature? Will we all get a copy of that? Okay.
The task force members will receive that. And We usually don't get it till closer to the end of the year, do we? They are working really hard this interim and shorthanded and lots of committee assignments, so they do great work, but it takes a little while. They're really, really well done reports. So, well, I want to thank all of you. On behalf of me and Senator Hildebrand, who couldn't be here, thanks for all the work you did and the time you put into the working groups. And, today feels like we're kind of cheating, getting out of here maybe a little early, but we paid for it the last time we met by having such a long day. Any other discussion, comments? Okay, we're adjourned. Thank you.